I'm Mark Neve, Chief Diversity Officer for the Association of American Medical Colleges. Welcome to our Diversity 3.0 Learning Series. We are very pleased to bring you this set of online resources, a source of insight from experts in the field on a range of issues which you tackle day to day. We've created these resources to help you leverage diversity and inclusion to drive institutional excellence. The AAMC is committed to serving as knowledge brokers, offering you the best content generated from within our network of relationships with thought leaders and practitioners. With this series, we bring this learning to your desktop or device for on-demand learning that suits any schedule. Visit us in the future for additional content, and thank you for watching.
Welcome. I'm Dr. Malika Fair, Director of Public Health Initiatives at the AAMC, and I'm delighted to have Dr. Philip Chan with us today. He's the 2013 Herbert Nickens Faculty Fellowship Award recipient. He's the Assistant Professor of Medicine at Brown University in Providence, Rhode Island. Dr. Chan, thank you for being with us today.
Thank you for having me.
So you've done such great work in HIV and AIDS testing and research and outreach. Can you tell me a little bit about how you initially were interested in this field?
Yeah, it's actually funny. So I initially started as a basic scientist, or at least more involved in basic research at the University of Vermont in Burlington. And just through my clinical training, I got more and more involved in sort of the personal aspect of medicine. I got drawn in specifically to HIV and STDs and the intersection of medical care, social issues. You know, when you take care of HIV patients, a lot of them are younger, a lot of them don't have many other problems, and you have a lot of other diseases that come along with it, such as homelessness, drug abuse, etc. So it's a real joy to sort of take care of these younger people and make a difference in their lives, especially a lot of these younger people.
Now, I understand that there were some issues that were happening in Rhode Island in 2011 with budget cuts. Can you tell me a little bit about what started your work, and specifically with starting your clinic?
Yeah, so in 2011, the only public STD clinic in Rhode Island closed due to budget cuts, and that's certainly a trend we've seen across many different fields due to public funding. And so at the same time, we noticed that the rates of HIV and syphilis were increasing in Rhode Island. Specifically, the rates of syphilis had tripled in the last few years. And most of that is due to is in men who have sex with men, so gay, bisexual, and other men who have sex with men, specifically people of African American or Hispanic descent. And so we opened a clinic, so myself, as long as with my boss at the time, Tim Flanagan, and a couple of the administrators, really pushed to open a public STD clinic at our institution. And so in January 2012, we opened our doors, and we were doing about 20 tests a month for HIV and other STDs. We're now up to 20 tests a day for these diseases. And it's really had an impact, we think, hopefully, on HIV and STDs in the community. We offer free and anonymous and confidential testing.
That's great. Now, you mentioned that you started out as a basic scientist, and now you're doing both basic science research and translating this research into your clinic. Can you tell me a little bit about how that research is actually translated on a day-to-day basis?
Yeah, so one thing, I am funded by the NIH. About 75% of my time is dedicated to research. But I really make it an important point to have all my research have a direct impact on the community and people. And that's one thing I think that's really important for us as academics and scientists to remember, is that our research should be translational in nature, should really at some point have a trickle-down effect to the community at large. And so what I'm doing basically is looking at the epidemiology of HIV and STDs in Rhode Island, and through my testing clinic, we're actually having a direct impact on being able to target the populations most at risk and offer services to the most disadvantaged populations and those affected most by HIV and STDs.
Great. Now, you mentioned this trickle-down effect. I know that you work as well in an academic setting with medical students and residents, and we know that it's important, and the medical students and residents are asking for more practical experiences. They want to have interface with their communities and understand the relationship between medicine and public health. How are you able to incorporate the training in medicine, medical students and residents into your practice?
Yeah, so I think it's an important thing that sometimes we don't catch during our medical training. So a lot of times as we come through our medical training, we see a lot of chronic diseases in older adults. So we see a lot of diabetes and heart disease. And one thing that I really try to do through the STD clinic is to show students, teach students, and have them learn about the intersection of medicine with public health and all the other aspects that go into that.
What sort of advice would you give to a student who's interested in reducing health disparities, improving health equity, if they're just at the beginning of their training?
So my biggest piece of advice would be just to get involved, to sort of look at the needs of the community. And that's one thing that we have to remember, is that we don't always know all the answers. We really have to sort of talk to people in the community, people around us, and use that as sort of an assessment of what we can do. And then the second thing is just to get involved and sort of do what you can. Sometimes when you look at all the problems, certainly if you look at health disparities, in general, it's very broad and overwhelming. And I think what we can do is just work from where we're at, sort of address the problems within our own fields, whether they be medicine, HIV, pediatrics, ER, and to have a clear vision of what we want to do and really take one small step at a time.
Now this clear vision goes beyond medicine or goes beyond medical students and residents, but what about for academic medicine leaders? What sort of vision do you think that we should have there, and what sort of advice would you give as we try to meet the needs of improving health equity in our country, reducing health disparities, and try to increase diversity overall?
I think we need to all work together. One thing I've learned certainly from implementing this STD clinic is that you have to really form partnerships with the community. It's really tough to work alone, and frankly nothing ever gets done if we work alone. We really need to sort of come together, have a clear vision about where we want to get to, and work from through the details from there. But I think working together, forming partnerships, collaborating is really key.
And we're delighted that you've been the recipient of this award. What sort of difference do you think the Herbert Nickens Faculty Fellowship will make in your work?
So specifically, I'm hoping to use this fellowship to reach out more in our community, to especially some populations we've having a tough time engaging. So we've still had tough time engaging a lot of the Hispanic people in Rhode Island. So Rhode Island's actually a center for a lot of Hispanic immigrants from South and Central America. We have a tough time engaging those populations. So I'm hoping to use this fellowship to engage populations like that, more disadvantaged populations, to provide both HIV and STD care, as well as get them engaged and hooked up in the medical system.
And so besides reaching these vulnerable populations, are there any of your own professional goals that you would like to achieve in the next 5 years with regard to your work?
So I'd like to sort of use the STD clinic model as a example of how to engage disadvantaged populations and look at not just HIV and STDs, but also how to bring these younger, otherwise uninsured, disadvantaged people into the healthcare system and provide preventative care. So certainly my expertise isn't HIV and STDs, but it's really looking at the broader impact of engaging these populations. And I think it's a very exciting time. We have the Affordable Care Act coming out. It's going to, despite its limitations, it's going to be interesting to see how that works in addressing a lot of the insurance issues in this country. So I'm excited.
Great. Well, we're excited too. We really appreciate you taking the time to chat with us today. And if you have any other questions or any other information that you would like from us, please feel free to contact. You will see our contact information at the end of this video. Thank you very much.
Thank you.